Today we're going to be using our lovely demo dog, Libby, once again to talk to you about palpation. What is palpation? It's basically what can you feel with your hands. So over the years, I've noticed that many of my clients, pet owners, have been maybe a little bit confused about what they're actually feeling on their dog. Is it normal or is it abnormal? Is it a tendon, a ligament, or a bone? So I'm hoping through this tutorial to help you to discern what you're actually feeling with your own hands on your own dog. So one thing that I definitely want to point out is that every dog has this ridge in the center of their skull, and it's called the external sagittal crest. It's basically where the two halves of the skull come together, and then it forms a little line or ridge that's prominent. Now, many times we don't even realize that it's there, but as our dogs get older, or if they have some sort of maybe dental disease and their muscles recede because they have big chewing muscles on each side of their skull, it seems as though this ridge becomes more prominent, but it's actually, there's atrophy of the temporalis muscle here. So it's very normal to have that ridge, so don't be alarmed if you suddenly feel that one day. As we continue our palpation tutorial, I'm going to focus on what's called the axial skeleton. Basically, that is the spinal column. So just like us, dogs have a cervical spine, a thoracic spine, a lumbar spine, a fused sacrum, and then coccygeal vertebrae, which make up their tail. So let's delve into that in a little bit more detail. When it comes to the cervical spine, all mammals have 7 cervical vertebrae, which I think is just fascinating. There's so much musculature in this area that it's really hard to feel the bones, the actual vertebrae in the neck area. But if you go just at the base of the skull, behind the ears, you'll feel a lump on each side. That is actually the 2nd cervical vertebrae, which is a nice landmark. You'll be stunned at how big it is on your dog. So again, my thumb and finger are on those points for Libby. And I'm going over the knob there. And that is her 2nd vertebrae, or axis. The atlas actually holds up the world, and or her skull. And that's actually tucked up under her skull there. And again, the first one we can feel on the inside and outside is the axis, or 2nd. Then we go down 3, 4, 5, 6, 7, at which point we have the thoracic spine. Now, what differentiates the thoracic spine? That's where all the ribs attach. There are 13 thoracic vertebrae, and thus 13 pairs of ribs. Occasionally, there'll be an anomaly that will be revealed on x-ray, but it typically doesn't cause problems if there's a variant number of vertebrae and or ribs. So if you go to the midline, you'll feel a bump, a series of bumps actually, as you work your way down the spine. That's the spinous process of each individual vertebrae in her thoracic spine. So unlike the cervical area, there's not as much overlying tissue here, so we can actually feel that bump sticking up. A typical vertebrae has a vertebral body, which is deep, lateral or transverse processes, which are on each side, as I pointed out with C2 here, and then a dorsal spinal process that sticks out. You can feel the same thing on your own spine. Next, we're going to move to the lumbar area. Now, it's really important to know where the junction is between the thoracic spine and the lumbar spine, because this is a point of stress. So how do I find that? Well, remember we said that the ribs connect to the thoracic spine. So if I trace Libby's ribs, and I can feel the series of ribs here laterally, up, 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 it kind of circles around like so, and it's actually way up here is where the junction of her thoracic spine and her lumbar spine is. So why is that a point of stress? Well, it's because The rib cage, the word cage, basically means that this is relatively immobile, whereas the lumbar area doesn't have anything holding it in place, so it is relatively more mobile. So when you have immobile meeting more mobile, again, high translatory area. There are 7 lumbar vertebrae. People have 5. So again, humans and dogs have 7 cervical vertebrae. Dogs have 13 thoracic vertebrae. We actually have 12. Dogs have 7 lumbar vertebrae. We have 5. Then we can go to the junction of the sacrum, which is a fused triangular bone in this area. Again, we have a point of high stress. Remember, the lumbar spine moves, the sacrum is fused together. People have 5 sacral bones to make up that sacrum, whereas dogs only have 3. Then, finally, to finish up the axial skeleton is the coccyx or tail. Now, we actually have a little bitty tailbone way up high in our pelvis with just a few little vertebrae in. So that's what we call a vestigial bone. The dog's tail, however, is highly functional. And again, with all the various breeds, sometimes they have a short little stubby tail. Sometimes they have an inverted tail. Sometimes they have a whip tail. Sometimes they have a big fluffy tail like Libby's. Now, it is very common to have a variable number of vertebrae when it comes to the tail or coccyx. Typically, it's somewhere between 15 and 23. I think 17 to 21 is probably the average. But the tail should be very mobile, be able to move on either side. You should be able to lift it without causing any distress. If it does, that could be a sign that something is wrong. And the carriage should be light and neutral. Again, equal movement to either side. So get used to feeling that tail too. And if your dog is relatively thin, you can find the individual vertebrae as they taper down to the very tip. So Libby's tail actually ends here, and then the rest is just her fluff. As we continue with palpation, I'm now going to be moving to what's called the appendicular skeleton. So that's basically the limbs as opposed to the spinal column and skull. I'm going to start with the shoulder girdle or thoracic girdle on Libby. And the bone that's at the very top is actually her shoulder blade or scapula. Now, it's important because there's a lot of muscles and things going on here to create shoulder stability for proper forelimb movement. And how you can orient yourself is if you kind of take your flat hand, you'll feel a ridge. So I can feel it right there going at an angle all the way from the top to the bottom, like so. That is the orientation of her shoulder blade. This ridge is called the spine of the scapula. And again, very important to kind of know where that shoulder blade is. As you follow it up, you'll find a point here on the back side, and that's called the dorsal angle of the scapula. A lot of times we rehabbers like to massage through that area because there's a lot of tension that's held by dogs around this area of the shoulder blade. As you follow the spine of the scapula the other direction, you will find a knob here on the front of the shoulder. That indicates where the actual shoulder joint or glenohumeral joint is. If you're very discerning, you might feel 2 bumps. One is the acromion and the other is the head of the humerus. So that's a ball and socket that sits right here, way up high. The humerus comes down, and the next thing that we can readily feel is the elbow joint because there's 3 knobs on the elbow joint. The outside is called the lateral epicondyle. The inside is called the medial epicondyle, and that point on the back side is called the olecranon. So that's very near the funny bone like we have for people as well. Dog's anatomy and our anatomy is very similar. So if in doubt, I bet you could figure it out by feeling your own bones and such. We're going to continue down as the leg tapers, and then you're going to feel some bumps again. This is indicative of the many bones that make up the wrist or carpus of the dog. There then is the digits or phalanges. They're lumpy and bumpy because they're made up just like our fingers of many different segments. And on the bottom side are various foot pads that we need to pay attention to make sure that they're in good shape. After all, that is their shoes. The foot pads feel quite leathery, and I'm going to talk a little bit later and go into more detail about the anatomy of the foot. To continue our palpation tutorial, I'm now going to move caudally toward Libby's hip girdle or pelvic girdle. So some important landmarks here. We're going to start in the pelvic region. The pelvis is made up of 3 bones, but on the very top, on either side of the spine, you'll feel a knob, and that is called the dorsal cranial iliac spine. Again, a good landmark to know as a pet owner. It's similar to the bump we have right here in our lower back on either side. As I continue down, I can take the flatness of my hand, kind of go over where I think that her hip joint might be, and where I feel some density or something poking out, that indicates where her hip joint is. This bone is called the greater trochanter, and a lot of different muscles attach to that bone. Now, the bone that Libby would sit on when she's sitting is back here on either side of her tail. I don't know if we can get through the fluff here, but it's right there. That's called the ischial tuberosity. So this bone on the ischium and this bone on the top are part of the big bones of her pelvis. The third bone that makes up the pelvis is her pubic bone, and we wouldn't readily feel that because that's way tucked up on the inside. Now again, we moved to that greater trochanter, which is indicative of the top of the thigh bone or femur. As we come down, the next joint is her knee joint. Okay, so we have the ball and socket of her hip, and then the folding and unfolding of the knee. So as we move toward the knee joint, you'll feel some prominent bones on the inside and outside, which represent the condyles of the knee. Lateral condyle, medial condyle. If you trace the thigh down, the first bone that you get to, this little knob here, that's actually her kneecap or patella. Okay, good to know where that is. Then you'll feel kind of a little density, like a cord about the size of a pencil in Libby. And the next bone is the tibial tuberosity on the top of her shin bone or tibia. So that orients you to her knee anatomy. And then we're going to continue down. This is actually the ankle or tarsus. Again, there are some bony prominences on the inside and outside, just like on the knee. And on the back side, this bone that sticks out is her heel bone or calcaneus, the calcaneal tuberosity. We continue down through the foot. Dogs, if you don't remember, actually walk on their toes. And so they have 4 weight-bearing toes. They're numbered from inside to outside. The very inside one that is not weight-bearing is a dew claw. Libby does not have a dew claw. So we start, that would be number 1, and then we have 2, 3, 4, and 5 on the outside. So those are her digits or phalanges of the back foot. The next section of our palpation tutorial is going to be focusing on some muscles, major muscles, because there are actually hundreds within the body. But what are the ones that are important for you to know as a pet owner? So again, if we start at the top, the skull has some major muscles for chewing. The one that's on either side of the ridge in the center is called the temporalis. And then in the cheek area is the masseter. So again, you may just notice an asymmetry when you feel that. It may be tender, it may atrophy, revealing that bump. If your dog is having trouble chewing, it could be a muscular issue. You never know. So those are some muscles when it comes to the skull. Moving down into the shoulder area, there are just so many layers and layers and layers of overlapping muscles. But the ones that I pay particular attention to are the biceps on the front, triceps on the back, just like our anatomy. biceps on the front, triceps on the back. The triceps is particularly important. It actually has 4 muscle bellies and is responsible for holding the dog's front end up when they're standing or weight bearing in any way. So sitting, jogging, running, walking, that triceps is very important. The biceps helps to flex the elbow. But again, if you feel, Libby's really cut, so I can feel her biceps right here. And again, just orienting yourself to the muscular anatomy of the shoulder. As we go down through the forelimb, it's a lot of little muscles eventually ending in tendons. I'm going to move up here. You have muscles on either side of the spine. The names are not that important. When it comes to the rear end, the 2 major muscle groups are your quadriceps on the front, just like our thigh muscle, and the hamstrings on the back, like the back of our thigh. So dogs can sprain or strain their quads and hamstrings. Their glutes, which is our rear end, are on either side of the tail. You have the glute medius and glute maximus. So again, sometimes feeling in there, you can tell if there's atrophy, especially if your dog has had a rear leg injury or is older. They'll often start to lose muscle mass in that gluteal area. And as I mentioned earlier, you always want to feel for any sort of asymmetry. The hamstrings is really, really important for dogs. Big, bulky, much more than our hamstrings is. And then the quads for keeping that leg supported in weight bearing. And finally, the muscle that I want to point out on the back of the lower leg up high is that calf muscle or gastrocnemius. So again, I mentioned that their anatomy is very similar to ours. So I just want to go through that quickly again. There's a couple muscles of the skull, temporalis masseter for chewing, biceps on the front side, triceps on the back side of the forelimb. When it comes to their rear leg or our leg, you have the glutes on the back side, front of the thigh is the quads, back of the thigh is the hamstrings, and then finally the calf muscle. Those are the major muscle groups that I think you should be aware of. So 2 other tissues that I want to alert you to are ligaments and tendons. Ligaments connect bone to bone and are responsible for stability of our skeletal system. Really hard for the average person, even me, after 20 years of doing canine rehab, to be able to feel ligaments effectively. They certainly get sprained and injured, but it's usually a stress test that indicates that there's a problem with the ligament. And then the tendon is tissue that's cord-like and actually connects muscle to bone. Now, in us and dogs, there are 2 big tendons that are easy to feel. And this is a palpation lab, so let's teach you what those are. The first one is the cord on the back side of the ankle or calf. So here's her heel bone again. Here's the knee. This is the ankle. And it's a thick cord-like tendon that is called the common calcaneal tendon or Achilles tendon for us. The other major tendon is in the knee. It's the patellar tendon. So we have our quadriceps. The first bump we run into is the kneecap or patella. And then the cord between that kneecap and the next bump, which is the tibial tuberosity, is the patellar tendon. So I can feel that right between those 2 bumps right there. So I'd like to delve a little bit more deeply into palpation of the feet and what you're actually feeling when it comes to the pads of the feet, because I think they're just fascinating. So the pads should feel leathery, okay? If they feel brittle and really dry, that can be a problem when it comes to traction. They can actually split, and that can be quite painful. And if they're too soft, maybe from inactivity, then they don't give them the protection that the dog needs when they're out walking on uneven surfaces and lumpy, bumpy ground that could be painful. Now you notice that there are actually 4 digital pads, okay? So that's under each toe. And then there's this heart-shaped pad, isn't it cute? That's called the metatarsal pad. And then finally, this non-weight-bearing gumdrop shaped pad, which is the tarsal pad. So all the pads in general are for support and protection because dogs, again, stand on their toes, okay, on the very ends of their feet, not on their wrists or their heel bone in the back. The color of the pads varies. It can be black, pink, or white, and sometimes it can be a combination of all three. Now, one thing that I recently learned, which I think is fascinating, is that the tissue here, which is skin, it's epidermis, okay, like our skin, is it actually has fat in it, under it, that does not freeze, thus allowing a dog to go out in cold temperatures, okay? But we always want to be mindful of too hot, too cold, because there are extremes that aren't tolerated well. So this heart-shaped pad actually provides a lot of cushioning, and it's similar to the palm of our hand. And the gumdrop shaped pad is not really all that utilized unless a dog is suddenly coming to a stop. It helps to stop them, or maybe going down a really steep slope. It helps to give them traction by kind of hooking and gripping there. Libby's foot shape is pretty typical. There are a few different shaped dog feet in that, depending on the position of the toes, if these toes are more medial and the paw is elongated, then that's called a hare foot. And if it's more rounded and kind of like this, doesn't that almost look like a tiger paw? So that's called a cat foot. So I would say Libby's paw represents a typical or standard type dog paw. Now, they have 5 potential digits in the front. Number one is actually the dew claw. And you can see hers a little long there, needs a little bit of trimming. Hard to see because it's white against the white. That's a non-weight bearing. It's kind of a vestigial toe. Some of them can be very pendulous. Some of them can be quite attached. Oftentimes breeders may remove dew claws, especially in the back, because they can get caught and cause trauma. And they're actually less common on the rear foot, but that's digit number 1. And then as we count, this is number 2, 3, 4, and 5. The middle 2 toes are the primary weight-bearing toes. And the foot should be very malleable to be able to articulate on all kinds of surfaces and maintain that grip and traction. So when it comes to Libby's back foot, it's very similar to her front foot. We again have the potential dew claw here, which she does not have. I don't know if it was removed when she was a puppy or if she didn't have it at all when she was born. Then we have digits 2, 3, 4, and 5 with the digital pads underneath each one. The heart-shaped metatarsal pad for cushioning. All the pads of the foot are for support and cushion. And then unlike the front foot, there is no gumdrop shaped tarsal pad up here. Some dogs have them. I think I've seen over the years, but that's more unusual when it comes to the rear foot. So not much different when it comes to the back foot versus the front foot, but the feet are so important in your dog's everyday function. They have to be able to maneuver their surroundings. They're used for traction, they're used for gripping, they're used for support. They are their shoes and their means of locomotion. So please don't neglect your dog's feet or toenails. Really important. Thanks a lot.